Hello and welcome to the Department of Medical Imaging at the University of Arizona and Banner University Medicine here in the beautiful city of Tucson, Arizona. I'm Dr. Jeff Rubin, chair of the department. It's a pleasure to have you with us. I've been honored to serve as department chair for the past 4 years, following an 18-year tenure on the radiology faculty at Stanford University and 10 years at Duke University. Congratulations on being selected to interview for one of our highly valued residency positions. We are absolutely thrilled that you have chosen to pursue a career in radiology. Our department is truly special, and I'm excited for you to get to know us and discover the unparalleled clinical, educational, and scientific opportunities that await you as a resident in our exceptional diagnostic radiology or integrated interventional radiology training programs. Our passion for serving our diverse community is at the heart of everything we do. Diagnostic imaging and image-guided therapies are crucial to the health of our community now and into the future. That's why resident education is a top priority for us. You represent the future of our field, and we are committed to providing you with the highest levels of education and training to ensure you bring the utmost value to your patients as a future radiologist. Our graduates go on to complete fellowships at some of the most prestigious programs across the country, and we're equally delighted when our residents choose to continue their fellowships with us. Thank you for considering residency training with us here in Tucson. I hope your day with us is both informative and enjoyable.
You know, as radiologists, we're kind of tasked with the job of teaching, the rest of the hospital, our language. I thought U of A, explained that to me, taught it to me very well, so much so that I wanted to stay and continue to teach people.
So I picked the University of Arizona because I loved what they were doing both in the oncology field as well as new research.
It's been a wonderful place to train. I've had wonderful experiences, met a lot of great people along the way.
For the first 3 years of your IR track, you are incorporated into the diagnostic radiology team.
During those years, we also get some exposure to interventional radiology, just like all of our DR colleagues.
As a third-year resident, you're responsible for more of the advanced procedures.
I really love our diagnostic rotations. I am thrilled that our programs are closely tied together.
Got a lot of young interventional radiologists that are doing a lot of really novel interventions as well as some really groundbreaking research, and I think that's what's making this program really exciting.
We are a level 1 trauma and we're a tertiary care center, so we see patients of all different kinds of pathologies, new presentations that may not be reported on other places. There's tons of opportunity to share what we're seeing here with other physicians and other universities.
We're doing lots of retrospective research to figure out areas where we can improve both quality but also learn new things.
We have some random controlled trials going on right now for cryoneurolysis, for PE.
We get a lot of things published here. We do, tons of chart review. We work with other departments to test kind of and determine the efficacy and feasibility of the procedures that we do as a standard right now.
I have done some amazing cases, both by myself and with attending supervision.
There's no hesitation to let us, kind of do things on our own, which is important. Figuring things out on your own is huge.
U of A made me do some very interesting and difficult procedures early on in my career as a trainee.
There's a lot of cases to do, but that kind of helps us figure out our efficiency, and it's great. I'm happy.
Tucson itself is a smaller town, but still has kind of that big city feel in terms of their healthcare demands.
We're doing a lot of hands-on work, both with patients, research, and with students. We as interventional radiologists get to help that patient in the way that we can so that they have better outcomes in the future.
We routinely send fellows and trainees off to either start the type of career that they always had in mind for themselves, or to pursue, fellowship and learning at other premier institutions in the country. So we have colleagues everywhere. We have a really robust network.
I'm going into private practice, and I'll be doing both diagnostic and interventional. And I feel prepared. I think the volumes and the case exposure on both sides of it, have prepared me well. I don't feel like there's any gaping holes in my experiences here that I'm going to have to fill in before I get to where I'm going.
A lot of hours and training, but I do think that the program does recognize that and makes it relatively friendly to allow you to have a family and have some decent time outside of work to do things.
I do feel like I have a good work-life balance. I do feel like I'm present. I'm able to be at the things I need to be at.
I'm married with 2 children. I'm able to go home and have dinner with my family every night. On my time off and weekends, I like to get up to Mount Lemmon. It's about an hour north into the mountains, but it's about 20 to 30 degrees cooler than Tucson.
If you wanted to do a little day trip in Phoenix, maybe Scottsdale, or try out some new food up in Phoenix, it's not too far away. And if you're trying to see a little bit of snow, you can of course see it at Mount Lemmon, but Flagstaff also is not too far away.
Beautiful golf courses here in Tucson, and then we like to eat. There's plenty of good restaurants here as well.
We have a great food scene here in town. We were one of the very first UNESCO certified gastronomy cities in the United States.
Of course, this heat only lasts, for 4 or 5 months. The rest of the time of the year, the weather is spectacular. Some of the best you'll find in the country, which really drew me to this program, as well as this phenomenal reputation.
I love it. I love every aspect of teaching because, I love the teaching that I got while I was here.
We have some of the best educators in the country coming here to work in both the interventional and the diagnostic realm. They're not only very approachable, but they're incredibly knowledgeable and very personable, and so I feel very fortunate to be here.
My personal interest is in medical education, and so having the University of Arizona College of Medicine right here in-house has been fantastic. I get to work with and inspire medical students to go into both diagnostic and interventional radiology at a much earlier phase than I was exposed.
So one thing that I've always really personally enjoyed about this program is the sort of very family-friendly and sort of really nice relationship that you have with the attendings, as well as between residents and fellows.
On both sides, we have a close-knit group, and we get along, and we do spend a lot of time with each other.
More importantly, though, I think the relationship that we have with the trainees, I think, is quite unique, and I think that fosters for a really good sort of patient care environment, as well as a good sort of teaching environment as well.
I love all of my attendings. I personally am on a first-name basis with almost all of them right now, which I think is huge, just because I feel like I can speak up and really have an opinion on patient care. So there's a huge remodel happening right now for our entire department offices. I'm really looking forward to having just more of a personal medical imaging space where we can all work together and grow.
Exciting next step for our program. We are able to do more. I think we're able to now acquire some more capital, better equipment, also more novel sort of tools to allow us to sort of be at the forefront of some of the newer interventions that are coming out.
And I'm happy to be to continue to be a part of the legacy here.
I do think that by the time that you graduate from this program, you are very well prepared and are able to really succeed as an interventional radiologist.
100% pick the University of Arizona again and again and again. There's nothing here that I don't love.